I often have patients that come in for their first visit to therapy that do have fear about what's going to happen on their first visit. Is this going to hurt? I've heard horror stories about my neighbor who said how bad their first visit to therapy was, and I just want to give a little rundown of kind of what to expect on your first visit to therapy. When you come in for your first visit, we'll start off by talking about what brings you in. What kind of pain are you having? What kind of movement dysfunction are you having? Are you having trouble lifting, walking, climbing stairs? Whatever that may be. An idea of how this came about. Have a discussion about your goals and what you want to be able to get back to doing. Then after that, we move into a portion of our examination where we look at your movement. We look at how you're able to move. We look at your strength, your overall just functional ability. Then from there, we put all that information together from our test and what we look at, and come up with a plan and say, okay, well, this is what your issue is, and here are the steps that we're going to take to fix it. And we always try to make that first physical therapy visit as painless as possible and as easy as possible. So after we've figured those things out, we will start some treatment on the first day, tailored to whatever your need is and whatever we find and think that will be the best option and the best way to attack the issue. We give you typically some exercises on the first day that you'll do at home to help start getting the ball rolling, and then from there we'll have our plan for how often we need to see you in the clinic and to work on your progression from there. I'm always very open to any questions or anything, so if you are having some questions or wondering about your first visit to therapy, feel free to give us a call here at the clinic, and I'll be glad to answer any of those questions and help take you through things.